So our next presenters are going to make their way up, and we have Tiffany Beckman and Faith Spotted Eagle going to present on Good Heart Grocery and Eat Right Deli Community Assessment and Strategic Plan.
Okay, so I know time is limited. Where this all started, this wonderful relationship with Tiffany and the University of Minnesota. I talked about Braveheart Society. 22 years ago, we decided that we would not be a neo-capitalistic entity. So like you have the U.S. government, you have the tribe, and then over here in the borderlands is where Braveheart lives. We didn't want to recreate a neo-capitalistic system. We wanted it to be grassroots. So we stayed out of these realms as much as possible. We tried to stay out of the tribe. We had a short experience with the tribe. We said, never again. So we went over here, although we partner with the tribe. We have our own integrity over here. We do not take government funding because we think that's a repetition, that's reifying the federal dependency. And we do support people who do, that's your choice. But we decided we'd only do private funding. And so after 22 years, that's what we did. And we went down the Missouri River on a boat, a houseboat. If you can imagine, Grandma's driving a houseboat. And we wrote a 50-year strategic plan to go into 2057. So one of the plans, there's many plans, but one of them was to have a grocery store. And so we already had a garden. We did much like the wonderful folks that up here that talked about their garden. We had a planter society back in the 1800s when they were really pushing for us to be farmers. We already had an element of farming, but they had a different idea. Of course, the government always has a different idea. So our people formed the planter society. So based on the history of that, we revived that because a lot of us grew up with these huge gardens. And we developed a half-acre garden, and we ran it for 11 years. We made one, I think, oversight. We had these kids working, and then the kids grew up. And we we forgot to mentor the younger ones, so we lost our workforce there for a while, but we did it for 11 years, and it was fun, it was beautiful, but it was exhausting, and we thought, we're going to take a break here, and we're going to look at some other elements, and then we'll go back to that. So what we did one day, one of our partners, Save a Foundation, called, and they helped us with our garden, and they said, University of Minnesota has an RFP, so we should apply for it. They called, and I asked her, I said, well, when is it due? She said, tomorrow. And so we worked frantically all night, all next day, and then we were on the phone, and she was sending in to somewhere in the caverns of the University of Minnesota. And when she got it sent in, the person said you had to have a physical copy of it to deliver. And so she happened to call another desk, and by the grace of Creator, someone at that desk said that they would deliver it. So whoever that person is, somewhere in the caverns of the University of Minnesota, thank you. But we did get funded, and what we did is we got $50,000, and we wrote a strategic plan. I don't know if they're going to bring it up. But it's kind of boring, but at the same time, it's very insightful. It's a 48-page document, and I learned some cool words that I had never knew, like market analysis, gap analysis, and I thought, oh my gosh, this is just like a whole new world. So what we did is we hired a CEO of People's Market in the Oakland area, wonderful man named Brahm Amadi. And they live in a food desert, if you can believe it, in the Oakland area. And in their communities, they don't have access to good food. So he came out and he helped us figure out and do the strategic plan. So we did 500 surveys. They said we should do at least 10% of the population. So we did 10% and 500 people. It was really just fascinating to talk to them. Really, really interesting. We tried to divide it up so we'd have a cross-section of the community. We came up with just like some of the previous programs, we just experimented. We did some research, but we came up with our own instruments. And we went to a nearby grocery store, the Turtle Creek Crossing in Rosebud, South Dakota. Is there anybody here from Rosebud? We noticed that that grocery store was having a really hard time. And so what we did is we knew that if we did that, we might be having a hard time. So we went over there and we partnered with them and we asked them if we could study what they were struggling with. And they said, sure, we want to figure it out too. And so they let us survey the customers that were coming into Turtle Creek. And they have a beautiful grocery store, and I'm happy to report it's doing better. But what they've neglected to do, and I didn't know this in the process of writing a strategic plan, they wrote their footage too large for what the market could handle. Makes sense, right? But if you don't know what you're doing, you don't know that. It's too big of a building for what you're going to deliver. The second thing that we learned from them, and we're very thankful, is that they didn't account for what would happen when their inventory was down. They just assumed that the inventory would be replaced by selling it, and it didn't work that way. So immediately they were behind and the shelves started to clear. So what that created in the customer's mind is that I don't shop out there because there's nothing on the shelves. They couldn't. So it created a public perception that it wasn't a good place to shop. The second, and this one really blew me away. If you ever go to the Turtle Creek store on Rosebud, it has beautiful, beautiful decor, and it's primarily cultural. And they have translations in our language of all of the foods. So they've got these big picture posters up on the wall. And I walked in there and I thought, this is so cool. Now, the thing that I was surprised about that I learned, when you do things for customers, customers don't always like what you like. That was a painful thing for me to learn. It was too quick. The change was just suddenly. So I would hear people saying, well, I don't go out there because I don't understand what they're talking about. You would think that people would be really glad that it was in our language, but they said, we just go to the other store, it's easier. So they continued to patronize the store that was non-native because that's what they always did. And then there was, remember I talked about safety and trust with trauma? There was immediate distrust of the store that belonged to our own people. So what we learned is if you're going to make that cultural change, do it gradual with your consumer so they can trust you. Because if you do it fast, they don't trust you. They think, what are they up to? So we began to realize that, and we had a very interesting outcome of this strategic plan. It's beautiful, it's very insightful, and it's a really awesome strategic plan, but it did not turn out the way that we wanted it to. We have 3 grocery stores in our community, and we're still a food desert. So when we went ahead and surveyed for location and as far as who they would patronize, the end result with the gap analysis, the marketing feasibility, was that there would not, a 4th grocery store would not be able to make it, which we were not expecting. So it said in the end of the result that we needed to diversify and we needed to go to prepared foods or a mobile grocery store, which was exciting for us because if you do a grocery store, that's a lifelong sentence, right? I mean, that's a lot of work. I mean, that's forever because people are going to eat forever. And so we thought that's generations of having to train people to do this. And somebody can do it. Somebody from the tribe should do it. So we switched to stream, and we are now looking out of this wonderful feasibility, and I don't know if they're going to bring it up. I think Jawad is looking for it right now, but we realized that we were going to develop this mobile grocery, and we're going to target on a certain season of the year. So we're going to have a food truck, but again, we live way out in the country. We live on the reservation, but we're going to market at the powwows because we hear a lot of the dancers say by the end of the summer, they're sick of greasy food. And so they're athletes. They're not supposed to be eating grease. So it's going to be hard to change the culture of grease. And so that's what we're looking at is how do we compete with Schwann's, because they're going to favor Schwann's just like they did at Turtle Creek, right? And there's going to be the distrust that they're going to present to us. So we're going to have to take that on, but we've done a minimum analysis and thinking about if we're going to do this food truck, we would do it for special events. We probably wouldn't do it year round, but to begin with, to make it successful, we would build the market. We would do the powwows, and we would do it, especially probably, we haven't decided if it's going to be summer or winter. We're still doing the analysis. And then after that, and we are fundraising. We're trying to seek funds, but we're thinking that it's going to take a minimum of probably $300,000 to $350,000 because the food truck is not cheap. And then we're going to have to do inventory and all the other factors, the insurance, the liability. It just keeps building. But, and I know one of the things that we're going to face with the historical trauma is that people are going to trust Schwann's probably more than they trust us. So that's what the challenge that we're going to have to combat. I think as far as I know in the Twin Cities here, you do have a native food truck, and I can't remember the name of it. I don't know if anybody is here from there, but we're looking forward to coming up and visiting with them. And we're thinking that primarily we would like to train younger people to take this so they could take it on into the future. We're pretty excited about it. I think that, again, we're going to have to convince our community that we can do this. I went to a presentation a little bit early from the Mohawk Nation, and they talked about the importance of developing relationships in the community, and that's what we're going to have to do. It's going to take a while. It's going to be a long-term investment, but it's something that I think the youth are getting excited about doing. And there's all of the other licensure, the food safety. But that's what we're here to just briefly share with you. And I know they haven't been able to pull it up. I don't know where Jawad is. But it was a very interesting partnership with the University of Minnesota. We had Tiffany, and she can talk about her experience as a unique person in her field. It was really a treat to walk into a grocery store with her. Like a whole world opened up. I had no idea those things were on the shelf. It was kind of scary, actually, to go into the store with her. It's like, oh my gosh, I'm eating that. But, and then she'll tell you, we'll talk about later, we went into one of the clinics. Immediate racism and some distrust came up right live while we were there. And we were just blown away. All we were trying to do was make a change. And as a result, we did, some change came out of that, and it was good change. But it was quite challenging to rattle. I think everybody needs to have their cage rattled every now and then, and we did that. And we did get some feedback, but we haven't given up, and we're still going to try to push forward. You want to add?
Yeah, so you mentioned going into the grocery store with me, and I'm remembering what that was like myself. Just walking in there, I remember seeing some things, and I thought, well, you know what? It says principal investigator. Be a good investigator. Get the data. Just do it quietly. Get in, get out, and share it with CDC later so that things can change, right? And so I'm in there, and I'm trying to tell our student now, shh, here, just follow my lead now. Come on. We were trying to do it incognito because the things I was seeing were something I really wanted to react to. And I was having a hard time sort of hiding my emotion and not reacting, but just being the detective that I am and getting the pictures. But some of the food was relabeled, so it had expired a year earlier. Some fried chicken was in the frozen food section, and there was an old label under it that was a year old. And so that was one prime example of the lack of quality foods in the Ihanktonwan community at a long-time grocer that's been there a long time. Then there was some fish that had 3 grams of sodium per ounce. And I looked at our team and I said, that's stroke food. Someone's going to have that's a lot of sodium in one small load. And I thought, well, that's not medicine. But there was examples like that. There was vendors selling sandwiches, and I didn't pick this one up. Our student did. There was a sandwich that didn't have any ingredients. I mean, you wouldn't know really what was in it or what the nutritional value was or really anything. And so who knows? It could be mystery meat, right? I mean, you don't know what was really in there. So those are some examples of what we saw, and they were disturbing.
It was a really interesting partnership to have Tiffany come in at the level of knowledge, and you want to share your background. So it's particularly important for our tribal community. In our community, we have a population of 3,000, and 675 are active diabetic in the clinic, and that clinic could serve them alone. So, considering what she does, I think that's really important for our tribal communities. Could you say something about that?
Yeah, so I'm an endocrinologist, and for a lot of people, they say, well, what is that? Well, it's a specialist in diabetes and thyroid disease and the like. And to our communities, I like to say it's the study of how everything is related. So we get a bit molecular in our training, and so we sort of understand the implications of what we put in our bodies and what can happen. But yeah, I'm board certified in endocrinology and general internal medicine. And I have a public health degree from the University of Minnesota School of Public Health in maternal and child health. So I have a big interest in this, and I don't like giving out pills and insulin in my clinical practice. It's like a slow death for me to actually have to do that. I like to be able to spend the time and do the educational component so that people have a chance at cure instead of kind of having to repeatedly come back. And I'm not sure if this is something that is proliferated in the medical societies or if some just don't know better or what, but I don't worry that people aren't going to come back, because if they're cured, the word spreads nationwide and more come. Then you see, you always have people you can help. So I never fear there won't be anyone at the table or at the door or in the office that I can talk with, because they're going to get what they should when they come, and I'm going to work at it.
And lastly, all love and praise to those tribal nations that have had grocery stores and have grocery stores. I know that Cheyenne River has one. I think it's Thrifty Market in South Dakota. Maybe some of the Northwest coast, but all love and praise to them, because you're feeding your people. And our time is up.